What's the worst thing that can happen after plastic surgery on a man? Well, some men may say that it's looking effeminate or feminine after having surgery. And that definitely is possible, especially when these operations are performed overly aggressively. So in this video, I'm going to show you a man who undergoes an upper and lower blepharoplasty and how I do it to help him still look like himself and still very masculine. So here's our patient today. He is a 40-year-old male who does not like the excess skin of his upper eyelids. And you can see one upper eyelid is definitely worse than the other. He also doesn't like the puffiness of his lower eyelids, and this is caused by fat that we can remove in a scarless, quote-unquote, scarless fashion, where we can take the fat out from the inside of the eyelid and leave no visible scars. So let's take a peek at his markings in the operating room. All right, here are his markings in the operating room, and we're going to be taking a bit more skin from his right upper eyelid than the left. You can see there, it is going to leave him with a little scar in the crease of the upper eyelid. I'm also going to remove the puffy fat from the lower eyelids, and we're going to do that through an incision on the inside of his eyelid. So the good thing about that is that there'll be no visible scar on his lower eyelids. A really nice way to do it. And we'll get this surgery done, and I'll show you how he looks right afterwards. Okay, we're all done with surgery. He did great. As you can see, a little swollen. This is all going to come down. He does have a little scar on each upper eyelid. Took out a good amount of fat from the lower eyelids as well. They always start off looking a little scary, but here in the next couple weeks, he's going to look real good. Now let me show you what we took out. All right, this is what we took out. There were 3 little fat pads on each eyelid, lower eyelid, and here's the extra skin that we took off. As you can see, a little bit less skin on the left than on the right. And a good amount of fat, so this is going to be a real nice change for him. All right, this is 3 weeks out, and you can see the puffiness under his eyes is gone. The upper eyes have been opened up, but they look real natural, which is totally key for a guy. You don't want it to be overdone. So as you can see, you can do an upper and lower blepharoplasty really well in a male and have him look masculine and natural afterwards. But the key is not doing too much. So in men, I always am a little careful when I remove skin from the upper eyelids to leave a little bit there to leave him looking still natural. And with the lower eyelids, quite often I do the scarless approach, where I take the fat from the lower eyelids out through the inside of the eyelid without removing extra skin. Therefore, there's no visible scars, and he heals very, very quickly. Now, this patient is only at 3 weeks out. Things are going to change over the next couple of months, but they're just going to look better and more natural. So I'm real happy with how he looks. So if you like this video, please subscribe to my channel. I've also got my main Tony Youn MD channel as well, where we give a lot of great non-surgical information also. Thank you so much for watching.